The Family Support Division has seen a huge impact in the amount of stress that families are under. The lack of resources, the being isolated, they have challenges that they've never had to experience before. And right now, we know that those challenges are causing traumatic events to happen in the home, and that the risk factors for child abuse are increasing, steadily increasing. And with families being isolated, not having all the service providers that they used to have in their home, they're at a loss for what to do. The stress of this and the long-term stress of this is increasing those risk factors for child abuse, and we know that it's happening, we just can't see it happening.
Victims of domestic and family violence are being enormously impacted by the COVID crisis. We have seen numbers increase across the board. We know from our law enforcement partners that domestic and family violence calls have risen sharply since the onset of the COVID crisis. We know that two things that lead to an increase in domestic and family violence are social isolation and financial hardship. And because of the COVID crisis and some of the related shutdowns early on, families were at those crossroads all the time in a way they've never been. And it's impacted our victims in a large way. We're seeing on our crisis lines phone calls from people who are experiencing more intense, higher lethality, more dangerous violence. We're seeing children who are not, they don't have eyes on them right now because schools aren't open, daycares aren't open, and so our child victims are just kind of stuck at home with nobody who might see them and see those marks and bruises and be able to call in a report to law enforcement or child protective services. They don't have their eyes on them right now like they usually do.
Right now, the profound effects that we've been seeing as a result of the COVID-19 virus is the uncertainty that people are facing as far as their finances as of today and their financial future. There's a lot of insecurity about their jobs, whether or not when the PPP loans run out, whether they'll still be employed, whether the level of business will be sufficient to support jobs, and how to cover their expenses and their bills over the long term. In addition to that, a lot of the loan modifications or forbearances are expiring, and there's a lot of uncertainty as far as even the amount of unemployment. So our clients are under the stress of not knowing what the near future holds, and there's about to be a wall coming up that people are going to start hitting when these aid programs start drying up. They'll be scrambling to keep their homes, they'll be scrambling to cover their living expenses, to figure out what they're going to do with their children in schools. Will there be any additional expense with the school situation? So there's a number of financial uncertainty that our clients are facing, and we're trying our best to keep in touch with them and keep them on the right track and let them know what their options are.
A lot of our clients who come in often feel very much alone and isolated. Social distancing sometimes affect how they connect with family members and friends. We've had clients come in to say that they even have fear, a lot of fear going on because they don't want to go to work. They work in manufacturing in certain areas and everybody's very close to each other, and they can't quit work because they have to make a living, but they are also afraid of getting sick. And so they come in and work with us to work through the having to deal with that. A lot of times clients don't have access to the supports that they had previous. Some of those social determinants of health, they aren't able to, it's harder to find housing, food, since kids are not in school, at least they weren't when they weren't during the summer, and also during the earlier part of the year. There were issues around food disparities and children being able to access food. And a lot of our clients came in, and we have case managers who work with those families so that they can obtain the things that they need to take care of their children.
As a result of the pandemic, we're seeing a sharp increase in both the frequency and the intensity of mental health disorders in children and adolescents. Those that had pre-existing disorders are suffering more difficulties as a result of the pandemic, and we're also having sort of new onset problems as a result of the pandemic. The effects of isolation and loneliness and the anxieties that people have about leaving the house or being around crowds or groups or even coming into the doctor's office is really creating new situations and compounding existing ones. So we're seeing a sharp increase in the need for services as well. More people in need and more difficulty getting to appointments because of barriers like the transportation barriers or unable to be in indoor environment barriers. Sometimes the individual child and the mother are fine to come into the office, but they live with somebody that's at risk at home, a grandparent or someone else that has a medical condition that puts them at risk, and so then the child and the mother don't feel comfortable coming in. And so the other profound impact that we're seeing is this major shift towards telehealth services. We are adapting a telehealth infrastructure. We have grown a capacity and an adeptness with dealing with telehealth services. And for some folks, this is working out really well. And I think we'll continue to deliver services via telehealth after the pandemic, because for some, this is actually a real benefit. But overall, we're finding we're a lot busier, people are a lot more distressed, there are more barriers and more creative ways of delivering the care that they need.